Are you okay in there, chick?
Yeah, fine.
Okay.
Serena is in a lot of pain. Her doctor has sent her to have an MRI scan at Warrington General Hospital. 4 months ago, it could not have happened. Warrington, like hospitals across the country, was forced to pause all non-emergency treatments. Serena would have had to live with the pain.
In the hospital, they take your temperature before you come in, and it's all cleansing, and so I have no fear at all.
Pre-COVID would have been full of chairs, which obviously we've taken out.
In June, procedures were started at their COVID-safe site. Staff here have been desperate to see their patients return.
All the additional measures that have been put in have just been one more thing, because it's so important to us that our patients are safe, because we want our patients to come. We're here, we're open for business.
The hospital is near to seeing the same number of COVID patients now as it did during the peak. The difference this time is that they're continuing non-COVID treatments. Every day, pressure grows on the hospital. It might be forced to pause non-emergency treatments again.
We absolutely recognise the length of time that some patients have been waiting on those waiting lists, and we will continue through all our planning to ensure that we keep those going for as long as we possibly can. But we do need to be mindful that there may come a point where we have to make some really difficult decisions around those services.
The hospital will battle to stay open, and it has one very important asset on its side: an on-site lab that can effectively test all pre-op patients and staff.
We expect to see a larger number of coronavirus patients coming into the hospital, as well as other patients. So we are committed to trying to maintain our elective surgery procedures as much as possible. So the demand on our laboratory is massive, and it's going to be a challenge to try and maintain our capacity to do those.
But even an effective testing regime can't create the capacity needed if the hospital is overwhelmed. Some really, really difficult decisions had to be taken ahead of the peak of the pandemic to create extra capacity in our hospitals. But we're only now beginning to understand the impact of those decisions on the nation's health. The patients, doctors, nurses, nobody at this hospital wants non-emergency treatments to stop. In the coming days and weeks, we'll know if that's a decision that has to be made. Ashish Joshi, Sky News.